Hello, my name is Kaylee Stevenson, and my intended career path is physical therapy. The scope of practice for a physical therapist. The scope of practice for a PT is actually quite broad. They usually focus on regaining or improving mobility after an injury or ailment that's caused by sickness or a disease. They also work to prevent and reduce injuries to the body by stretching and by using the use of exercise. Overall, they provide many rehabilitative services for patients and treat anyone from children to the elderly. Interactions with other medical professionals. PTs also work alongside many other medical professionals. These include physicians, occupational therapists, recreational therapists, and special education teachers. Many of the duties of these other professionals go hand in hand with those of a PT. There's usually some collaboration between them in order to create the best treatment plan for the patient. The daily routine of a PT. The daily routine of a physical therapist can vary depending on the patients they're seeing that day. The usual PT shift is actually a day shift, and they usually work from 8 a.m. to 5 p.m. However, some may choose to start earlier and some may choose to end later in the day. Normally, a PT will spend about an hour on each patient, and then after each session, they take time to update and document the patient's treatment plan. In addition, there are usually routine meetings amongst staff members a few times a week. And like I mentioned earlier, they could be treating someone who suffered an injury in a car accident or someone who's suffered an injury from a stroke. Therefore, their daily activities depend on the individual cases that they're treating. Their work settings. So PTs work in many different settings. They work in hospitals, private practices, schools, nursing homes, and sports facilities. And these are just to name a few. Also, some PTs work in the homes of their patients in order to meet their needs, and some even travel the country treating their patients. Education. In order to become a physical therapist, you need a bachelor's degree and a science-based major. Then you must complete a doctorate of physical therapy, and this usually takes about 3 years. Exam requirements. Every PT must be licensed by their state in order to provide treatment. In order to become licensed, you must take the National Physical Therapy Examination, or NPTE for short. The test consists of 250 multiple-choice questions. 50 of these questions are not graded and are being tested in order to see if they should be on the test next year. The score range is 200 to 800, and a score of 600 is considered passing. License requirements. In addition to the license discussed in the previous slide, some PTs may wish to be certified or licensed to become specialized in a certain area. This is optional and is offered through the American Board of Physical Therapy Specialties. To become certified, one must complete at least 2,000 hours of clinical work or complete a residency program and then pass an exam. However, you don't have to be certified to work in some of the specific areas of physical therapy. Volunteer and/or clinical hours. When applying to PT school, you should have experience volunteering in a clinical setting. It is suggested that you have experience in multiple settings, and this will give you an advantage when you're applying to PT school. In addition, you should have roughly 40 to 50 hours in each setting, but most applicants usually have many more. In addition, clinical hours are usually obtained while working on your doctorate of physical therapy degree. Continuing medical education. Some PTs choose to continue their education and may complete a residency or fellowship. However, it is required that all PTs continue their education and stay up to date on all relevant information in the field. Your license must be renewed on a regular basis, and Florida, for example, requires 24 hours of continued education for each renewal year, but this requirement varies depending on the state. Professional organizations. The main professional organization that supports the physical therapy profession is the American Physical Therapy Association. This is a membership-based program that represents PTs, physicians, or physical therapy assistants, and physical therapy students. They have leadership opportunities, councils, jobs, and honors programs for their members. There are individual chapters for each state as well. Professional journals. In addition to everything else the APTA does, they also have a physical therapy journal that is constantly updated. This can be found on their website. Another journal that has great information regarding the PT career is the Journal of Orthopedic and Sports Physical Therapy. This is my tentative timeline for how I plan on achieving my career goals. So, December 2018 through May 2020, I will be finishing my undergraduate degree. Currently, I'm a junior. So then April 2019, I will start researching my graduate schools. And then June through August 2019, I will start volunteering at physical therapy offices during my summer. And then June through November 2019, I'll start studying for the GRE. November 2019, I will take the GRE. December 2019, I will start sending out my graduate school applications. May 2020, I will graduate from my undergraduate career. And then May through July 2020, I will be completing more volunteer work. And then August 2020, I will start graduate school or PT school. August 2020 through May 2023, I will be completing my Doctorate of Physical Therapy. And then September 2022, I will take my National Physical Therapy exam. And then in May of 2023, I will graduate from my graduate school and I will start my career. These are all of my references, and that concludes my presentation. Thank you very much.